DESIblitz.com.
Hi, I'm Dr Talha. You're watching me on DESIblitz.com. We should take mental health problems more seriously. In the COVID pandemic, there's been a greater number of mental health problems. More people coming to A&E with overdoses, more people coming to General Practice with depression or low mood. We need to think twice about mental health. I worked through the COVID pandemic on the front line, in General Practice and in the emergency department at times too. We were seeing many more people come forward with mental health problems. That being said, it was tough for us too, working on the front line. I saw all of us going through it. Personally, myself, I had problems and worries about bringing the virus back home. My honeymoon was cancelled. My marriage was delayed. I failed the last exam I needed to become a GP. That being said, that exam was postponed. Over that time, I found myself getting more worried, more anxious, more tense. These were new feelings for me. It was tough to work through that. Nonetheless, I could see many of these same things in my colleagues too. We were really in it together, working together. I didn't feel the need at the time to speak to anyone about my anxiety and worries. I think I wish I did though. As a man, often we just want to get through it. That being said as well, in our communities we often don't talk about mental health problems. What really got me through was a supportive social network. I saw other doctors going through the same things. We all had ones we were worried about. We had loved ones we were trying to protect. We had our concerns about our career, about going forward, about trying to be safe, and obviously at work trying to manage something we didn't know how to treat. I monitored my mental health by journaling. It was so helpful to get all of it out, to put it all on the page, just to let go. It was a real safe space for me. I think what was concerning for me was when I found newfound anxiety in there. It was creeping in. I don't think I realized it. I had worries and tension. I didn't know how to process that, and that was new for me. Nonetheless, it was something that really helped me. The same with prayer, the same with exercise. These were the things that I fell back on. When everything else falls apart, what more could I fall to or look towards to help me? I tried to combat stress in many different ways. Having a supportive social network was really helpful, knowing that we're all going through it, particularly at the height of Ramadan. Furthermore, exercise and journaling were really helpful too. At some points, gyms were shut. Therefore, I set up my own little home gym. Writing things down and turning to prayer were really important for me to get through. The most unforgettable act of kindness I experienced during the COVID pandemic still makes my heart warm when I think about it. A particular family member got ill. His other family members were helping him. I did a little bit, as we do as doctors, to try and help and facilitate his care. They were incredibly grateful. They sent me a large gift of chocolates and a card. It was very touching. I still think about it to this day. To know that you've had that impact on people and helped them, it makes my day, and it makes me know that I made the right choices in my career too. Take a deep breath is my private diary from working in the first wave of the COVID pandemic. It was really worrying time. It affected our personal lives, our careers as well. We were doing our best, but sometimes our best may not have been good enough, or we had weaknesses in ourselves. This chronicles the highs and the lows, my romance, mental health, physical health problems. I'm currently working on a follow-up piece to it as well. It's called I Need a Second Opinion with my wife, who's a junior doctor too. There's a spoken word piece too, accompanying Take a Deep Breath. Having been through the ups and downs, worries, nervousness and tension of working through the COVID pandemic, I would like to think I am a bit more supportive to patients in a way that I wasn't before. I've learned a lot more. It's a really tough time for anyone, for everyone to be honest with you, particularly those that come forward. I always want to try and give extra time to people when they have stuff to get off their chest. I think the importance of having a supportive social network is incredibly important. I always put a focus on having a healthy lifestyle. One study showed that over 1 million people from them who exercised had 1.5 lesser days of mental health. These are the things I try to point towards. I think if you have these symptoms, it's important to touch base with your doctor. If you're feeling low, even if it's just for a chat. There's so much you can do yourself though. Empower yourself. Read, exercise, whether it's jogging, whether it's working out at home, whatever it may be. There have been a number of British South Asian communities that have suffered with mental health in the COVID pandemic. The charity Mind has actually documented that, and they said that in a study of 14,000 people, that's exactly what they showed, that South Asian communities have suffered with mental health problems in the COVID pandemic. There are a number of factors for this: economic deprivation, finances, immigration is another known factor. I would like to give the example of my grandmother. When she made the partition in 1947, she saw her entire family slaughtered in front of her. That lived with her for the rest of her life. So much more could be done for those suffering with mental health. That's why I'm trying to think twice about it. I've set up some mental health workshops. Overall, I think the focus needs to be on understanding more about it, recognizing the symptoms of mental health problems, how to treat it, whether that's yourself or with a doctor. I think so much more needs to be done. Don't suffer in silence. Think twice about mental health.